Hello cruel world, my name is Dr. 𝐏𝐬𝐲𝐝 𝐡. I'm a Consultant Forensic Psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. So I got a request from one of you good people to do a reaction video to a viral video of a man with catatonic schizophrenia. So it's about a 10-minute clip. I'm going to talk through it. I have seen catatonia in my clinical practice. It's very rare, but I've seen it twice in my career. So I'll tell you a little bit about that. It's going to be educational. I'll tell you the psychiatry behind catatonia as well. Let's get straight into it.
How are you feeling?
Well,
How long have you been here?
3 months, May 17th.
Okay, so right off the bat, we're getting an impression of this man, the patient who's being interviewed. His posture is very, very stiff and he is hardly moving at all. Now, it could just be nerves because he's being kind of publicly interviewed, or it could indicate something like catatonia. So catatonia has a number of symptoms which I will get onto, but one of them is stupor or decreased movement. So he's rigid. He seems to have psychomotor retardation. Let's watch a few more seconds and I'll give you my comments on psychomotor retardation.
And what brought you here?
That's difficult to answer.
Could you give me some idea?
Offhand, I can't.
Okay, yeah, so I just wanted to make sure that he was consistently going to be like this, and he is. So I think this man is displaying what we call psychomotor retardation. So when you do a mental state, when a psychiatrist examines a patient, there's a few things that you look for immediately, like their body posture, their interactions, gesturing, etc., etc. This man has a clear lack of overall movement. So far as I can tell, his eyes only have been moving. So this is called psychomotor retardation. You see it in catatonia, you see it in severe depression. The opposite is psychomotor agitation. So somebody could be really excitable, like constantly fidgeting, can't sit still. So a good example of that would be somebody who's suffering from a manic episode where they're full of excitement and energy and literally can't contain themselves. That's the first thing I noticed. The second thing I noticed is, you've probably seen this as well, there's a delay in his answers. So there is what we call thought blocking. So that can be a symptom of psychosis, or it can also be a symptom of catatonia, and I will unpick those later on in this video. So he's taking a long time to process information that's fairly basic. So it's taking a while for his thoughts to come in. And he's got poverty of speech. So he's answering in very short terminology, saying the minimal amount to get by.
Whose idea was it that you come here?
A psychiatrist.
And what happened that ended up with your being here in the hospital?
The psychiatrist decided that this was the situation for me.
So already with his answers, he seems to be not having much substance behind what he's saying. He's kind of answering very defensively. Now, it could just be that he's a bit suspicious or paranoid. Could be that he's just uncomfortable being interviewed in such a manner. Or it could be because, as I said before, he's got this thought block, so he's really struggling to process his own thoughts. I think we'll probably find out the answer as we watch more of this video. By the way, I should have mentioned this is the first time I've seen this.
Did he tell you why?
No, the psychiatrist did not.
Has anybody told you why?
No.
Have you any idea why?
Yes.
And what is that?
I am not completely like other people.
What do you mean by that?
People dislike me because I am not completely like them.
Okay, so far with what he's saying, there's a couple of possibilities. And again, I think it will become more clear as we watch more. It could be true. It could be that he's been in this sort of semi-catatonic state and people have been judging him, or maybe even made comments, so that's possibly reality. Or it could be paranoia. Let's see if the psychiatrist pushes a bit more. I'm going to go into a little bit of the science behind it now to educate all y'all. So first of all, I'll tell you what catatonia is. Catatonia in itself is not a diagnosis. It is a syndrome, which is a collection of symptoms, and I'll come into some of those symptoms later, that is caused by another psychiatric illness. So it used to be thought that catatonia was only related to psychosis like schizophrenia. But more recently, we've found out that it's related to mood disorders as well. So very severe depression, something like mania that I talked about before, and also kind of other rarer neurological diseases like, for example, meningitis, encephalitis as well. And if I had to sort of briefly summarize what catatonia is, it's complex and multifactorial, but it's about abnormal movements. So in this guy, we can see that he's absolutely rigid still. He's got a decreased facial reactivity, so he's hardly moving. In fact, he's not moving his face at all, only his eyeballs. Immobility and abnormal behavior and a kind of social withdrawal. So that's like an overview of what it is. I will get into some more specific symptoms, but first I'm intrigued to see whether he actually exhibits them or not. So let's continue with the video.
And in what way are you different?
I am trying to do with my life something which few people try to do.
So that was a really pronounced thought block. You could see him processing. And at this point, I don't think he's being defensive. I think it just, because of his catatonic mind, he's really struggling to process what the question is. It's taking him several seconds to answer a very basic question.
And this influences my thinking and consequently my actions.
What is it you're trying to do with your life?
Play the piano for people.
I'm not clear. How is it that playing the piano for people has eventually resulted in your being here in the hospital?
I sit differently when I play the piano, and when I'm away from the piano I occasionally look differently from other people, and this has caused dislike from people.
They dislike you because you sit differently at the piano?
Yes.
Okay, so it seems that he's got a very superficial level of insight. So insight is an understanding and appreciation that you're mentally unwell. So he knows there's something different about him. He knows that he's standing out. People see him as odd. But so far, he hasn't alluded to the fact that he's suffering from any actual mental illness. So he thinks that other people are thinking he's odd, but he's not yet acknowledged that there's something actually wrong with him. Something different maybe, but not actually something wrong. So let's see if that changes or not.
What way do you sit at the piano that people would dislike you?
I cannot describe an illustration of how I sit.
And I can't imagine it, that it would make people angry at you or at least dislike you.
So I think the psychiatrist is rightfully kind of trying to push this patient a little bit to really test his insight. So psychiatrist is fairly politely, not sure I'm digging his tone, because there's something a bit too authoritarian, not enough empathy and chatty enough as I would approach my patients. But to be fair, this was the 60s, I believe, so maybe things were just said in a different manner back then. But he's trying to push it. So he's basically politely saying, okay, I'm accepting what you're saying, but you're not giving me enough. So what you're saying is not enough of a reason for people to dislike you. So he's trying to see if there's any other symptoms that this patient acknowledges or not.
How do you know they dislike you?
My father does, and doctors do, because of the way I appear.
Okay, so I think I'm now getting a clearer picture of some paranoia. Does his father dislike him? I think it's unlikely. I suppose at a stretch you could say that his father, I don't know, might not be particularly empathetic to his mental state, might have made some comments, might not be particularly pleasant man. So possibly I might go for his father disliking him. Doctors wouldn't dislike him. A doctor might be intrigued by him, might want to treat him, but there's no logical reason why a doctor doesn't dislike this man, or several doctors. So the point I'm trying to make is this is, to me, stepping outside of reality. This is psychotic. So I think he's got paranoid delusions. So delusions are fixed, unshakable beliefs that don't make sense. There's lots of different types. Paranoid delusions are very common, especially in the patients that I assess who've committed offences and violence. So typical kind of psychotic delusions might be what this guy is saying. So people don't like him, people are watching him, judging him. Higher level, more dangerous kind of psychotic delusions that I see in my patient cohort might be that people are trying to kill them, people are trying to poison them, the FBI are following them, their cameras watching them, they've planted chips inside them to monitor, that kind of thing. So those are some examples. Let's see if this guy gives us any more.
In relationship to the way I sit at the piano and occasionally stand when I am away from the piano because of the way I sit at the piano.
How do you stand when you're away from the piano that they dislike you?
I can't describe an illustration.
So this psychiatrist is really trying to push to try and get more, but I think he's hit a dead end here. I don't think he's going to get much more out of the patient because the patient's kind of batting his questions back, he's resisting, and he's kind of repeating himself as well. So I think this is a dead end. Let's continue.
Does it feel to you any different from the way other people stand?
Yes, it feels different.
In what way?
This is becoming too involved to describe.
Would I be right in assuming then that you don't feel that you belong in the hospital, but that other people did feel that?
As soon as I express the belief that I do not belong in this hospital, which is a mental hospital, then those who dislike me want to find a worse place for me.
Again, I'm getting a very paranoid flavour behind his beliefs. I think this man absolutely needs to be in hospital, because if this is his level of functioning, if he can barely move, then there's a huge risk of deterioration, of not being able to look after himself, of possibly not even eating if he's in this mental state. So he absolutely needs treatment, but he seems to have some paranoid beliefs about why he's been hospitalised and other people's intentions if he was to leave hospital.
I'm not sure I understand. Could you make that clearer for me?
No.
Okay, so he's definitely getting some resistance from this patient. Poor guy, you know, like, I'm commenting on him, but it must be just horrible to be in that situation where he's really struggling with his thoughts, he can barely move. And this is a result of catatonia. So I'll tell you a little bit more about what catatonia, actually what the symptoms actually are. So I have to say, this man is not, as I was expecting when I clicked on this video, he's not full fat catatonia. So he's definitely got some of the symptoms, but it's not full on, certainly not as severe as I've seen in other patients. So here are the symptoms. You get stupor, which is what this man is showing, which is a very decreased reaction and relating to the environment, but also like bodily movements as well. Then you can get something called cataplexy, which is also known as waxy flexibility. And to me, this is one of the more interesting aspects of catatonia. So that means if you move somebody's body, they're so resistant to movement that they will keep their position. So literally, if you put somebody's arms up like this and left them, they would stay like that for hours and they wouldn't feel like this discomfort, but they're so unwell, they literally don't have the drive to put their hands down in a more comfortable position. And then in full-blown catatonia, you get mutism, which is where you say almost nothing. So this man's got a poverty of speech, so he's saying, not giving much detail in his answers, but he's definitely not mute. A couple of other very unusual, very rare but fascinating symptoms that unfortunately I've not seen in this guy, so I can't physically show you, but I'll tell you about, are the following. So you can get stereotypy, which is a repetitive, odd, non-goal directed movement. So I've seen a patient who had catatonia who would do this like rolling as if he was like rolling something in his hands or playing the piano, and he would just do it constantly like that for no reason. No matter what environment you put him in front of, whether he was in his hospital room, whether he was sitting out in the patient ward, whether he was in front of the table being fed dinner. So it's like a non-goal direct, a non-purposeful kind of repetitive action. Then you can get echolalia, which is where you repeat something that somebody says. So you're so confused in your psychotic state that if somebody says something like, hello, hi, how are you? You just say, hello, how are you? And when I've seen this in clinical practice, which as I say has only been once or twice, it's quite haunting because obviously there's very little, they're like very robotic. There's like a deathly look behind their eyes and you speak to them, hello, how are you? Hello, how are you? Hello, how are you? So they're not fully there. Their mind is really, really struggling to process everything, really. And then another one which is similar to that is echopraxia. So that's when you mimic someone else's movement. So somebody stands up from the desk and you stand up, and the patient stands up from the desk. They sit down and you sit down. And again, there's this sort of robotic, very dead kind of vibe that you get from them, and you feel that they're not mimicking you on purpose. They're just literally in such utter confusion. They're swimming in the sea of psychosis that they're only able to process things so slowly in tiny bits of information that they just repeat what they see around in the environment.
Is this a way of...
Yes, I can. As soon as I express the belief that I do not belong in this mental hospital, then those who dislike me want to find a hospital where the living conditions are not as good as this.
But why are you in the hospital in the first place? I'm not clear.
Because I'm working to do something which, in my life, which most people do not do. This influences my thinking and occasionally my actions, and a psychiatrist has noticed this.
What has he noticed?
Likes the actions and the thinking, and has decided that I should be here to change them.
What actions?
How I talk and how I look.
So I suppose this guy does have, as I said before, a level of insight. So he's correct. What he's saying is correct. Somebody is worried about or judging, depending on your perspective, how he's acting, how he's interacting, how he's talking, how he's looking, and therefore has presumably sectioned him against his will to treat him. So he's right. But I think the key part that he's missing is that he doesn't acknowledge that there's a valid reason for it. So he doesn't acknowledge that he's got schizophrenia, that he's mentally unwell. Already we've seen some paranoid symptoms. I feel this psychiatrist is digging into the patient's insight. He's not really asking him about further psychotic symptoms, which are really important in diagnosing this case. As I said, I haven't seen this video to the end yet, so maybe he'll come on to that. So I don't want to hold my judgment just yet, but I will come on to that. Let's continue.
Right at this moment.
And how would you describe the way you're talking and looking right at this moment?
As other people talk, and at this moment, however, I've been told that it is not the way other people talk and look.
Have you any idea in what way it's not like others?
No, because I believe it is as other people talk.
Okay, so that's a key phrase for me, because this definitely shows a lack of a degree of insight. So he's basically just indicated that he doesn't believe that what he's doing is abnormal in any way. So he understands that other people, including doctors, psychiatrists, thinks that what he's doing is unusual and needs to be treated, but he himself doesn't think it. So that really shows that he's got a lack of ultimate insight.
So then, from your point of view, not from other people's point of view, from your point of view, you look, you talk, you think, you behave as other people do. You're very interested in learning to play the piano. You sit at the piano a little differently from the way someone else might, and you stand somewhat differently.
Occasionally I stand differently.
Now that in itself doesn't seem on the surface to be sufficient reason for being in a hospital. So what other reasons have been given to you, or what other reasons do you understand are the causes of your being here?
I'm supposed to not be mentally well.
Oh. And what's supposed to be wrong with you?
No doctor has told me.
So I think it's very unlikely, I can't completely rule it out, but I think it's very unlikely that no doctor has told him. I think it's more likely that he's either forgotten or is confused or just disagrees. So he's kind of intended to block out previous information. I have to say, this psychiatrist is kind of pushing the same topic of conversation. I'm not sure, I think he's flogging a dead horse. I'm not sure he's going to get anywhere with this. So it's a bit unnecessary, I think. I think we've all established quite clearly now that this patient doesn't have insight. So if it was me, I'd move on to other important parts to do with the paranoid delusions, whether he's hearing voices, etc., etc. Again, I don't know, maybe he will come onto that. Let's see.
It's hard to believe.
I tell the truth.
What are your plans? If things should go well, if you were to leave the hospital, then what?
I need financial help from my father to prepare me for obtaining a job as a piano instructor at a university where I will be able to teach people how to play the piano and also play the piano for people.
Okay, so I think this is quite interesting. So his future plans are quite realistic. Obviously not now when he's in this catatonic schizophrenic state, but in terms of after he's been treated, they're quite realistic. That seems like a feasible plan for the future. The reason I'm mentioning this is because I was wondering whether he might have grandiose delusions. So some people with schizophrenia, they have, as well as paranoid delusions that I spoke about before, they have grandiose delusions. So patients that I've seen believe that they're going to be famous movie stars, famous rappers, celebrities, famous scientists, where they don't have any kind of training or expertise or experience in those roles, and those are grandiose, whereas this seems quite realistic. So he might have other grandiose delusions, but he certainly doesn't about his future goals.
Have you had the training yet to permit you to be an instructor?
No, I have not.
Despite what I just said, I assumed that he was a piano player, so my bad. If he's not played the piano at all and has no kind of skills or expertise, which is unclear for me from this video, then I suppose that you could argue that he's actually grandiose. So scratch everything I just said. I made that assumption. Naughty me.
Have you tried?
I don't understand what you mean by...
Have you tried to get the instruction?
Yes, I have tried.
What's happened?
I have not had the correct environment for the instruction, nor the correct financial help for the instruction, nor the correct instruction.
Have you been accepted for such instruction?
By some teachers, yes.
And by others, no?
Yes. Again, it has been about half and half.
And so I'm a bit confused, actually. I can't tell whether his plans are grandiose. On balance, I would say probably they're not grandiose, probably not delusional, because as I said before, for patients that I've seen, when they're delusional, they're clearly like psychotically completely unrealistic. Whereas what he's saying might be slightly unrealistic. I can't really tell how good he is at the piano, but it's not grandiose delusions, basically.
Have you started any such instruction with those who did approve of it?
Yes.
And how has it gone?
With some it has gone well, with some it has not gone well.
Right, so I was kind of giving the psychiatrist a chance because I wanted to know whether he was going to ask more appropriate questions to try and elicit the symptomatology from this young man with catatonic schizophrenia. To be fair, this is a 10-minute clip and it's very feasible that it's been taken out of the context of a longer clip where the psychiatrist eventually does get round. But I do think he's being a bit repetitive in his questioning, and I think he's gone to a few dead ends and keeps pushing and pushing and pushing for little results. If it was me, I'd want to know about all other potential psychotic symptoms that this young man has, specifically hearing voices, whether he feels safe, all those things I mentioned before, whether he thinks he's being followed, etc., whether he thinks he's got special abilities. So, right, to conclude this video, this is a viral video. It's got, at the time of me recording this, 21.3 million views. Wow. So that is on average about 21.3 million more views than my average videos gets. It is quite interesting. I have to say, he wasn't as catatonic as I was expecting, given how popular this video is. I thought we'd have full-blown catatonia. This guy has a couple of the features, although he's not as ill as some of the other people that I've seen in my clinical practice, like the person I told you with cataplexy, waxy flexibility. This man was able to communicate. People with full-on catatonia are usually in a stupor, so they can't sort of interact with their environment in any way. They can't answer questions. They look kind of petrified. It's really tragic. It's a really sad thing to see as a psychiatrist, but thankfully it's really rare. Just to finish off, I'm going to tell you very briefly about the treatment of catatonia. So ideally, the treatment should be medication, oral medication. So you can give benzodiazepines, which are kind of muscle relaxants, and over time, over the space of a few weeks, people will gradually get their movement back. So that's happened to the rare cases that I've seen in the medium secure units where I've worked. Or in extreme cases when patients can't take medication, you can either give them an injectable form or ECT, so that's electroconvulsive therapy. It's got a really bad rep for good reason. In the past, it was used in a very barbaric and brutal manner, for example, without using anesthetics. It's much better now, and even though it's got a bad rep, it's actually very helpful in extreme situations. And catatonia is exactly the kind of extreme situation where if somebody's not eating, if their life's at risk, then ECT can actually be life-saving in those situations because it works quicker than medication does. All right, so that's basically all I have to say. I hope that was educational. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living in courts and in prisons and in psychiatric units. I urge you to watch some more of my videos. In terms of recent videos, I've done some high-profile kind of serial killer-y cases, like psychoanalyzing the butcher baker who literally hunted down and killed his victims hunting with a crossbow. I've done a video on the Zodiac killer and my kind of psychoanalysis. Of course, the Zodiac killer's never been caught, so a lot of it is speculative. And I do a range of videos. If you like your true crime with a sprinkle of psychiatry, go 𝐿𝐸𝐲𝐝, check them out. I've done a psychoanalysis on Tim Westwood recently, on Boris Johnson, on Tommy Robinson. And it's part entertainment, part educational, I hope. Right, I've been rambling on enough. Hope you found that educational. Have a blessed day, stay euthymic, and do not forget, I love you.